Okay. All right, good afternoon. Hi, my name is Melissa King and I'll be your nurse today.
Hello, I'm Sarah.
Hi, Sarah. I'll be giving you an examination and starting with your optic nerve, cranial nerve number 2. We will talk about first the different tests that they do to test your vision. One is the Snellen test, which is an eye chart that you look at that determines your distance vision. And that's usually recorded in a result of a fraction, with 20/20 being your normal range. And then if you were, say, 20/30, the numerator and the denominator reflect the distance at which your vision was. The other test they do is a Rosenbaum test, and that test determines your nearsighted, whether your near vision. And a normal vision reading for that would be 14/14. Okay? All right. So now we're going to check your peripheral vision, and that requires a little test. Okay?
Okay.
All righty. So now I'm going to have you hold a card over your eye, and I'm going to hold a card over my same eye. Okay, just like this. I'll cover your entire eye. Like that? Okay. So when you see the bunny, I want you to say now, as soon as you see it, as soon as it comes into
Now.
vision. Okay?
Now. Now. Now.
Okay, very good. And we would go on and test the other eye as well in a full examination, but you get the idea.
Okay.
Okay? All right, okay. Now we're going to check your corneal reflex. Okay, and I'm actually going to use the pen light for that one. Okay, so if you'll just look straight ahead, I'm going to shine a light right into your cornea. Okay, and the corneal reflex is present and equal in both eyes. Okay. All right. Okie dokie. Sorry. Okay. Now we're going to check the external of your eyes. Your eyebrows are symmetrical, full, no patches of hair missing in your eyebrows or your eyelashes. The lids on upper and lower are non-swollen. All skin is intact. The mucosal lining of your eyelids are pink, moist, no signs of dehydration. The lacrimal sacs are palpable. Conjunctiva and cornea clear. Sclera is white and clear. The irises are both blue, symmetrical. I'm going to shine a light into your pupils. Pupils are equal and reactive to light. Want you to focus on my fingers. I'm going to just test your focus coming in and out. Very good. And our pupils constrict as they come closer. Now we're going to check for convergence. I want you to follow it together to your nose, and our eyes converge as would be expected. All right. Okay, now we're going to test cranial nerve 3, 4, and 6, which would be your oculomotor nerve, your trochlear nerve, and your transducens nerve, which is your up, down, and lateral movement of your eye. Okay? So I just want you to track with your eyes and not your whole head. Okay?
Okay.
So we're going to go in an H-like movement. Very good. Follow, no nystagmus. Her eyes are tracking and following with every movement. Now we're going to do a wagon wheel. Okay. Very good. Again, our eyes are tracking bilaterally, symmetrically. No nystagmus evident. Okay, good. Okay. Now we're going to test the cover-uncover test. This is to test your focal balance with your eyes, okay? So this is going to make sure that your field of vision is consensual in both eyes, all right? So I'm going to have you focus on my fingers. I want your field of focus to be right there, and I'm going to cover one eye. And when I remove the cards, I want to make sure that that eye is also focusing on the same eye as your right is, the uncovered eye. Okay?
Okay.
All right. They're both focusing in the same direction. We're going to do that with the other eye. Focus on the fingers. And and they are consensual. All right, very good. Okay. Next, we're going to assess your ears. Your your optic nerve. Well, your ears would be your acoustic nerve, but we need to finish assessing your optic nerve first. So your cranial nerve 2 is where we're going to assess next, and that's going to involve looking into your eye and looking at your retina. And the retina, when I look into your eye, you can actually see the inside back of your eye where the optic nerve is and the blood vessels and the other structures of the inner eye. Okay, so I'm going to actually shine a light and look right into your eye. If anything's uncomfortable or if you need to take a break, just say so. Okay? Okay. All right. Increase the magnification. Okay. And I see the retina there. I see the retinal vessels. There are 4 where it enters towards the optic nerve. I see the retinal background is red. There are no lesions, no plaques evident. There's the macula. Okay. The optic disc is evident. Appears as a white area. There's a crescent. See the crescent. Okay. Okay. The clarity is clear. Okay, very good. All right, now we're going to do cranial nerve number 8. Okay, that would be your acoustic nerve. Okay, so we're going to look at your ears, and bilaterally your ears look like they're equal. The superior portion of your earlobe is parallel to the outer edge of your eyebrow. They are symmetrical proportion to your head. The pinna recoils. The external ear is pink. There's no signs of lesions, no signs of exudate or drainage. Is there any pain?
No.
Okay, now we're just going to put on our otoscope head so that we can visualize the tympanic membrane. Okie dokie. And you're going to have to pull up and outwards your earlobe in order to lengthen the eustachian tube to get a good visual. Okay, I can see the tympanic membrane. It's non-bulging, opaque in color. There's no signs of perforation, no drainage, no redness, no swelling. Any pain?
No.
Okay. And the cone of light looks like it's at 7 o'clock. And that would be consistent with the left ear. Okay. All right. Okay. Look in the other ear. Tympanic membrane is intact, slightly red. I see the umbo malleus and cannot see the other structures in this ear because there's a little wax buildup. Okay. And that's normal. Okie dokie. So now we're going to do a series of tests to test your the acoustic nerve, cranial nerve number 8, for the conduction, the vibration of your bone conduction with this tool called a tuning fork. Okay, I'm going to have the tuning fork vibrate, and I'm going to place the instrument on your head, and I want you to tell me if you hear it in both ears.
Okay.
Okie dokie.
I hear it in both ears.
Okay, now this Weber test is what it's called, determines the bilateral hearing, and she hears it in both ears. There's no lateralization, so that's good. Now we're going to perform the same test to test the conduction, the bone conduction, and also air conduction. And this will be done, this is called the Rhine test, and this will be done on her mastoid process and then in front of her ear. Okay, so I want you to tell me when you stop hearing the vibration noise, and then I'm going to quickly move it in front of your ear, and then you tell me when you stop hearing it there as well. Okay, we're going to do it on this ear for the sake of the camera, okay?
Mm-hmm.
Okay?
It stopped. It stopped.
Okay, so you had it stop almost immediately.
Mm-hmm.
Okay, very good. Very good. All right, so we got the hearing test done. Now, so we've got the Rhine test, the Weber test. There's one more here, the whisper test. We're going to do the whisper test. Okie dokie. So now I'm going to have you cover this ear, and I'm going to whisper something in this ear. I'm going to whisper 3 words, and I'd like for you to repeat them. Okay? Are you ready?
Yes. Eyes, ears, nose.
Oh, very good. Eyes, ears, and nose. Very good. All right, well, good. Okay, so now we're going to look at your nose and examine your nose. Now, your nose appears to be perfectly shaped, symmetrical, proportioned with your face. The exterior skin is intact, no signs of lesions or tears, does not appear to be occluded. I'm going to feel your nasal bones are anatomically correct. Any pain?
No.
Okay, and now we're going to look up your nose, and it looks like the nasal septum is midline, no deviation. I can see her turbinates are open and clear. The mucosa inside of her nose is clean, pink, looks healthy in color. Okay, I would like for you to occlude one of your nostrils and breathe in and out. Any problems or difficulties? No. Okay, let's do the same with the other nostril. Very good. Okay, so now we're going to test your olfactory nerve, cranial nerve number 1, and we're going to test your smell. Okay? So I want you to close your eyes, and I'm going to place a substance under your nose, and you're going to tell me what it is. Okay? Okay?
Okay.
All right. Okay, here we go.
Cinnamon.
Very good. You can open up and see that cinnamon. All right. Now we're going to do another substance. Close your eyes. Okay.
Vinegar.
Yeah. Real vinegar.
Yes, real vinegar.
Very good. Well, that shows that your olfactory cranial nerve number 1 is functioning normal. Okay. All right. Okie dokie.
Definitely real vinegar.
Well, now we're going to examine your mouth, okay? And we're going to look in your mouth to check the structures. First, we're going to look at your lips, which are perfectly symmetrical. The skin is intact, moist, no signs of fissures, chappedness. Lips look good. Open up. There's her lower lip mucosa, lower lip frenulum is intact. Can you lift up your tongue? The top of her tongue is moist. You can put your tongue back down. Moist. There's minimal plaque on her tongue. The papilla are visible. Lift up your tongue. Okay, and the frenulum is intact. I see Wharton's glands. That's where her saliva comes from. And you put your tongue back down. And then the gums are pink. No evidence of gingivitis. No redness, no swelling. Okay, I'm going to actually count your teeth. Okay, if you can. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, okay, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28. Okay.
Surprise.
So you're missing a tooth.
Yes, I am.
Your right upper back molar. What happened?
A car accident.
A car accident. Wow. Knocked your tooth right out.
It did.
Bless your heart. Okie dokie. Well, she has no fillings, no dentures, no partials, no bridges. We're going to now assess her uvula. And I want you to open up your mouth, say and swallow. Okay. So her uvula is midline. It falls up and down with vibrations. That would be your gag reflex, your talking, coughing reflex, where your uvula and your soft palate would fall up and down. And that would be your glossopharyngeal nerve coupled with your vagus nerve. So that's your cranial nerve number 9 and 5. Now we're going to check your hard palate, and it is intact. The arch is good with rugae that follow down into her soft palate, one continuous tissue. That looks normal. Okay. Okay. Now I want to test your cranial nerve number 10. Number 10. Your nerve to see your it's your hypoglossal nerve to see if your tongue, can you move your tongue left or right? Perfect. Perfect. Okay, dokie. All right, you did good. Okay.
Before you continue, do you want to show that you're in HIPAA compliance and that no one else is in the room?
Oh
with
yes,
us?
let's scan the room. Okie doke. Okay. We're now scanning the room. Okay. All right, and then we'll do the floor. Okie dokie. Okay, those note cards don't have anything on it. That's just the cover for the eye test. See? Okay. All right, very good. Okay. All righty. Now we're going to go back. Okie dokie. And now I believe we're at the lung examination piece. Okay?
Okay.
Okay. You're such a good patient.
Thanks.
You are.
You're a great nurse.
Thank you. Okie doke. So now we're going to check your chest. Okay, I'm just going to feel your ribs all feel good. There's no masses or nodes. Everything feels in proper position and alignment. Can you stand up for a moment? Okay. So I'm going to come up under the 10th rib. I want you to take a deep breath. Oh yeah, chest expansion is good. Any pain with that?
No.
Another deep breath. Very good. Now I would like to check and see if I can feel the resonance from your lungs when you breathe in and out, the vibrations, by using the ulnar aspects of my palm. So I want you to make the sound, the words 99 over and over again while I palpate your back, where your lung fields are. Okay? Okay.
99, 99, 99, 99, 99, 99,
Okay.
99, 99, 99.
Okay, and I can feel the resonance. I can feel the fremitus from her lungs on the ulnar aspects of my hands, which is good. It's just normal. Okay, so now I'm going to feel and listen for signs of solidification or abnormal structures as I go along your lung fields. Okay. Come around the front. And It all sounds normal air underneath the structures. Okay, very good. Now we're going to do a similar test, but this time we're going to see what the diaphragmatic expansion is. And I'm going to need to perform this tapping on your rib cage as you inhale and then again as you exhale. And actually you exhale first, okay? So I want you to take a deep breath and exhale all your air out and then hold it, okay?
Okay.
Okay, so there's a dullness sounding there. You can breathe normal. Now I'm going to make a little mark here on your skin, okay? And now we're going to do it again, and this time you're going to take a deep inhale and hold it. Okay, you ready?
Uh-huh.
Okay, go ahead, inhale and hold. Okay, and then here's the other mark. Okie dokie. And now we're going to measure the difference between the two. And it looks like 4 centimeters. And that's perfect because the normal diaphragmatic excursion would be 3 to 5 centimeters. So that's perfect. Now before you sit down, I'm going to listen to your lungs. Okay? And just would like you to take some nice breaths in and out your mouth. Okay? And we're going to start the top lobes of your lungs and work our way down systematically, comparing side to side to your lower lobes. And I'm hearing normal air exchange in all of our frontal lung fields. Same breath in the back. And I hear no evidence of bronchi, rales, crackles, wheezes, atelectasis. I hear normal breath sounds in all lobes of her lungs. Let me get one more listen to the bases. Take a deep breath. Good. And lift your arm up over here. Very good. You lift both your arms up. Take a deep breath. Very good. And again. Very good. Okie dokie. Alright, so now I'm going to have you take a seat. Okay. And so now we're going to listen to your heart, but first I'm going to feel your chest. Okay, everything feels appropriate. I'm going to feel for the apical pulse. Okay. All right, now we're going to listen. And I'm going to start at the pulmonic area. The aortic area, which is over here on the right. Second and third intercostal space. And now we're coming back over to the left to the pulmonic area, and now Erb's point in the tricuspid area and the mitral valve area. Okay, and I'm hearing all normal S1 and S2 sounds. No evidence of murmur, no bruits. Okay, so now we're going to assess your pulses, and we're going to start with your temporal artery. Nice, positive, strong pulse. Okay, we're going to bypass the carotid and come over to the brachial pulse. Okay, strong. Okay, now we're going to the radial pulse. Very good. We're going to bypass the femoral pulse and come to the popliteal, which is posterior the knee cap area. Okay, now we're going to come down to the anterior pretibial pulse, which is right there at the ankle bone. And then finally we're going to reach the anterior dorsalis pedis pulse, which is right on top of that foot bone. And that's nice and strong. Well, thank you very much, Miss Sarah.
Thank you, Missy.
I appreciate it. Thank you. Okay.